All right, guys, welcome. This is your first ever recording for ethics class. So sit back, relax. I think there's a way on YouTube. If you Google, I think this might be illegal, but probably not in this context. But if you Google YouTube to MP3, if you ever want to just listen to this in the car and you want to put it on your phone into like a music player or something, you can Google YouTube to MP3. You go to some website that look kind of sketchy, but most of them don't give you viruses. Just pick the top one on Google, and then you can click the link for this YouTube video or in the address and put it in there. It'll download it on your computer in MP3 form. Just a pro tip if you want to listen to this in the car or something on your phone. So anyway, today we're going to talk about ethics and consultation, but really what we're talking about, or that's the class, I guess. Of course we're going to talk about it. But we're talking about professional identity. And I'm going to throw a whole bunch of information at you. But what we really want to do is get a sense of, ask this big question of who are we and who are we not? Okay. So that's kind of going to be the bulk of what we're talking about. Well, let's start by what is professional identity to ask these questions. How similar and how different are we to other professions? The same question I just asked. One of the things we can think about is, this is really small. Oh yeah, that's a little better. One of the things we can think about is, what kinds of activities do we do? So when you think about what your future work is, or the other counselors that you've seen before, some of you have in your head a school counselor who's walked around the halls of your school and sometimes invited people back to their office, sometimes doing group work in a classroom or in a gymnasium, or after a big traumatic event, they're sort of having special sessions with people in the gym or in other places, whatever. There's all kinds of different activities. If you were thinking you're going to be a mental health therapist, you've probably been to some, I don't know, like what do they call, like a strip mall or some old house that was turned into a therapy room or whatever the settings you've been to. You probably have that idea where there's a hallway with some private rooms and a sound machine maybe, and a couch and a chair and, whatever. You've been to these places before. And yet there are a lot of things that counselors do. Some of them overlap with other professions. I'm going to talk a lot about these today, about social work, marriage and family therapy, psychology, rehabilitation counseling, school counseling, college counseling, career counseling. There's all these different kinds, right? So we're going to be thinking about, how do we categorize these in a perfect world? Well, I shouldn't say perfect. Let me give you another analogy, because we're going to be talking about the medical profession a little bit later. In the medical profession, if you have a family practice doctor and you go there and they say, I kind of am a generalist. I diagnose and treat all kinds of different ailments, more common ones really. But if you have something special going on with your foot, I'm going to send you to the foot person. And if you have something special going on with your nose or your brain or your heart, or, there's all these specialists, right? And it's pretty clear in those specialty roles of, the heart surgeon does the heart stuff, and the brain surgeon does the brain stuff, and the foot person does the foot stuff. You know what I mean? So it's really helpful to say, what are the various roles? And talking about these activities is helpful. However, the trick is that there's a lot of activities that both social work, psychology, counseling, marriage and family therapy, all these kind of things, a lot of them do a lot of the same stuff, and there are very subtle differences. And yet there's still disputes, I guess is maybe the right word, or advocacy is the more PC term that we use. There's advocacy to try and gain professional power, professional relevance, and credibility so that we can do things like accept insurances or, I don't know, work at certain settings or something like that. So I'm going to talk as we go through here about the reasons why it's important to differentiate, and also the reasons why it's important to be the same. These issues will affect you. The question is how much you want to get involved in all the controversy, because there are some good reasons to, and also some really good reasons not to get involved in the controversy. This is drama, right? So we're thinking about, what are the activities that we do? Also thinking about, what are the services we provide to the public? What kind of training do we get, and how is it similar, and how is it different from other places? Our qualifications and credentials. So we'll dig more into these individually, and probably more helpfully, I'll give you more samples and examples of different similarities and differences in these different ways. So let's talk about counseling specifically. And maybe when we get together, one of the things you can think about, and I'll tell you this since it's our first lecture that you've had online like this, if you have questions as we go throughout, write them down and then bring them up in class, because I'll come to class next week and I'll say, what kind of things do you guys want to know? What was interesting? What wasn't? What is stupid? What is cool? What is, all that kind of stuff. So do that as we go through. Let's talk about the philosophical foundations of counseling. I'm going to skip forward, actually. How far forward do I have to skip to get to the part that I want to? Okay, you see this here where it says counseling was established in the 1950s with the development of the American Counseling Association. Keep that in mind as we're talking about this. I'm going to tell you a little of the history and we'll skip over when we get there. In the early 1900s, there were mostly just medical doctors going to make medical, well, maybe the late 1800s, going out to people's farmhouses and out to people's houses in the community. And they had those black bags full of vials of tonic and leeches or whatever they carried in those things, potions of different kinds. I don't even know. And they would go out to these different places and treat people in their homes. This is before we had doctors' offices and hospitals and medical facilities and all that kind of stuff. As we had people like Sigmund Freud saying the medical profession is advancing and there's this other kind of other important part to treating people's physical body, it's also treating their mind. So that was the late 1800s. He was a psychiatrist. And so going into the 1900s, there were psychiatrists and then there were these psychologists. So they sort of differentiated themselves from the medical field, doing more like I don't want to say counseling work, but psychotherapy. So those people who were psychiatrists walking around with their bags of tonics and leeches, they said, we don't really do the chemical stuff. We just talk about this mental stuff. We are psychotherapists. So then psychology was born out of the medical field. Fast forward to the 1950s, psychologists were doing a lot of this psychotherapy and work, but it was oftentimes focused on the people who were the most confusing and complex and difficult and different and the really challenging cases. And yet people were realizing there's a lot of really normal issues that people have that we want to help with. And we're not just trying to get people out of dysfunction. We're trying to help them thrive in life, to like do well and live their best life and that kind of thing. So counseling was born in the 1950s-ish, slightly before that, but it was sort of established in the 1950s as counseling, mental health care for normal people. And I'm going to use today's language to describe something they didn't have words for back then. But when we say things like the wellness model, what we're really trying to express there is how do we help people live well? This isn't just treating the most unique and strange situation. In fact, you'll find as you go through the program, we're not going to spend a ton of time on things like really complicated personality disorders. You'll see them, but we're not going to spend a ton of time on treating them. Same thing with schizophrenia and really unique, uncommon disorders. We practice more of like depression, anxiety, and a lot of the more common ones. Post-traumatic stress, trauma disorders, obsessive compulsive, that kind of stuff. So it's not just treating the dysfunction, also treating people how to live well, live their best life, that kind of thing. So this will become important because you can take those two extremes and say, I just help people at the pinnacle of their life experience when they're self-actuating or something like that, which some people do that. Others say, no. I really focus on the more medical aspects of this. So I'm treating symptoms of depression, symptoms of anxiety. And all those are within think of this like a Venn diagram. Those are within the activities and the services to public that all fit within this counseling world. I've already mentioned this kind of second bullet point right up here. Most problems are developmental and normal through the lifespan. So I guess it's worth mentioning that it's not just, depression and anxiety, sort of normal person, or maybe more normal adult situations, but it's also what does normal development look like? Throughout the 1900s, as we learned more about what benchmarks people make in as their children and their adolescence, and becoming adults, that kind of stuff, we started to learn more about what kind of mental health conditions do people have. The moral development from children who need to be told from an authority figure what is right and wrong, to being able to make decisions for themselves about what is right and wrong. The cognitive capacity to think abstractly and to I don't know, just there's all kinds of stuff. In fact, this is one of my areas of research that I'm kind of just now getting into. Been into it for a while, but I'm kind of formalizing it. Is understanding how does what's the socio-emotional development? In other words, we use words like attachment and the effect that our ACE scores have on us, or adverse childhood experiences. How does our environment impact how our heart feels, where our pain lives in our subconscious? I'm throwing out all kinds of spaghetti to see what sticks with you guys right now. How the pain gets internalized through our social relationships and through our environmental sense of belonging and appreciation, that kind of stuff. And then what that does to us later in life when we find ourselves in a situation where we should be perfectly happy with a job and a family and a home and all these kind of things, and yet we feel empty inside. It's just an example. There's lots of circumstances, but there are these conditions that are, something about it is social, something about it is emotional or attachment related. There's some neurological parts to it too, in terms of how we develop, our brain develops and really takes in those messaging from people that we love and care, and turns it into the way we operate in our mind, that kind of stuff. So most problems are developmental and normal through lifespan. It's not just a dysfunction to be depressed. It might be a normal part of the process of life that you missed out on, or you didn't get the nourishment that you needed from a person who's supposed to love you. And now you're feeling the effects of that later on when you're really partnering with somebody and wondering why you're not feeling their affection towards you, or some, just throwing out examples here again. Another tenant, sorry, I'm itching for a sec here. Another tenet is prevention is better than intervention. In other words, if we can help people live well and have good preventative practices, things like we make a big deal about self-care and well living and that kind of stuff. I don't know that we really do a whole lot of that, and I'd be interested to hear what you guys think about that. Do we actually take a lot of preventative measures? Do we treat people that way? In my opinion, most of the therapists out in the world and even the counselors, they don't get money until there's a problem. And so we're incentivizing intervening in a problem rather than preventing something and helping people live well. This is the philosophy that we live by, but I don't know that actually happens in practice. So I'd be interested to hear your thoughts about that too. And then, of course, client empowerment. Back in the early days, back in the 1900s, we'll say, and psychologists were the medical professionals, the doctors who said, you come in, you lay on my couch, and you just say a bunch of crap and hope the subconscious finds its way out. And I get to interpret it, especially if you're having dreams about it. I know how these dreams work, and I know what they mean, and I will tell you, and then you'll pay me. That's I'm being a little tongue-in-cheek about it, but that's kind of how it worked. Now we say things, thanks to Carl Rogers and many others since then, well, you tell me. You're the expert in your own life. You tell me what's going on, and I can help reflect things back to you. But oftentimes when I hold up my psychological mirror to you and you say, like, I'm feeling sad because I got in this argument and I said some mean things, and oh, maybe I'm sad because I'm feeling guilty. We have those kind of insights inside of us. And so we tend to focus more on those kind of interventions than being the powerful authority who tells you who you are and how you are and that kind of stuff. So client empowerment's baked into the counseling world. So let's talk a little bit more about this wellness model and what that exactly means. I've described it before about how this is kind of us thriving and not just sort of fixing dysfunction, so to speak. I'm going to describe a couple, not just the wellness model in that first bullet point up there, but I'm going to describe the medical model first, and then I'll describe some other models that are common to other parts of counseling as well. So the medical model essentially says, think your experience at the doctor's office. You're sick, something is wrong inside your body, and you're like, or part of you, there's something not going well. And you go to the doctor and they say, okay, well, I think I see the problem. You have a bacteria, you have a virus, you have a cancer, mutating cells, you have a broken bone, you have something that's not right inside of you, and we're going to do our best to return you to health, to return you to fully functioning, something like that. So we'll give you medicines, casts, radiation treatments, chemo, whatever the thing is. In other words, we're going to remove that dysfunction from your life, okay? The treatment means find the problem that's inside of a person and fix it, okay? Now think of another model here that I'm going to describe to you. Another model is the social model. And the social model, it's not as common in the counseling world, but it's still pretty prevalent. and it's not in your book, but this is a really big one in my rehab world. Excuse me. In the rehab world, some people say, think of the deaf and hard of hearing community, the wheelchair community. They say, I wouldn't normally have a problem buying things at this store, but you guys put stairs here, and I'm fully capable of shopping, but you guys created a barrier that is not a problem with me. It's a problem with the way the environment, the structural, architectural environment is set up. So the social model says there are limitations that exist outside in our world that are not really dysfunctions or problems within us. Does that make sense? Think of it like this. If you walk into Gallaudet University in Washington, D.C., it's an all-deaf school, all-deaf faculty, all-deaf students, all-deaf advisors and chancellors and all kinds of people. You walk in there and you're a hearing person and you start talking to people and they're like, we can't understand you. Or just think of the same thing. You travel to Mexico. Would you walk into a university like that and say like, well, you guys all speak Spanish. You guys all speak sign language. This is weird. This is a problem. No, they'd be like, actually, you're kind of the outsider here. So the idea is the problem the lack of ability to hear and thus communicate in English? Or is the problem that the world doesn't also speak Spanish or sign language? So the social model says there's something going on outside that doesn't allow us to live our best life. In other words, the problem is not within us, the problem is outside of us, okay? So the wellness model is like not quite the social model. It's not the medical model. It's more focused on like, what are the ingredients that you need to bake into your life, inside of you, the choices you make, the activities you engage in, the behaviors you engage in, and the way you use your feeling to regulate it, to manipulate it so that you feel well, you think well, and that you live well ultimately. And the way we think about it is not so much fix your environment or fix the problems within. It's sort of like adding to your life the right recipe so that you get just enough exercise, just enough social involvement, just enough intimacy and physical touch, and enough water and food and exercise, all that stuff, right? It's more of this sense of like, if you just add all these things, it'll be okay. So these are different ways of looking at this stuff. Some of you who have a more like social justice focus on this, or very, I don't know, like a lot of people in the faith communities like to say, well, this world's gone to shit. And so if we just change these things and get us back to this other way of living outside of us, that's kind of like the social model as well. So there's a lot of us that focus on that kind of stuff of like, change the environment and things go better, right? And then there's a lot of us who say, well, isn't the DSM a very important book? Don't we have to pay attention to this thing? And it's all full of these symptoms. And the insurance will pay us and we get to work within the medical community and people acknowledge medical symptomology and problems and diagnoses and that kind of thing. So shouldn't we be focusing on that stuff? The answer is that kind of all of it's true. And even though we say we have this philosophy of the wellness model, there's still quite a bit about this. There's a range of the way people think about what counseling is. If you're asking me, I'm a little bit of all of them. I mean, I don't strongly bend towards one or the other. And I'll say more about that because there are times when I say, there's a problem in the system and I need to advocate that this problem is not with my client. There are other times where I'm like, depending on the circumstances, I might focus more on like, here are the things that you could be adding to your life that would just improve it and make it better. And other times I'm like, well, I have to make a diagnosis and this person's suffering and I want to get this right because having that diagnosis could potentially open up treatment doors and different communities they can get support from and that kind of stuff. So there's all kinds of reasons to say, aren't they all kind of part of the recipe here? But lots of debate over those, controversial. Part of the wellness model too, getting back to what that specifically means, mental health is on a continuum. I don't think there's a whole lot more to say about that. You guys can probably understand kind of what that means. You've had days when your mood and your whole being and seemingly like the direction in life and your trajectory in life, all of it seems to be kind of off. And other times when you're like, yeah, things are looking up, job's good, love life is good, I'm growing and I'm learning and I have enough money and all that kind of stuff. And so you probably get a sense of what that continuum means, even in the general sense. I think I've kind of already mentioned this, but this is another way to say it. Goal is to maximize human potential, not just alleviate symptoms or cure illnesses. And then it also is that other stuff. So that's kind of what we're trying to sort out here. A big advocacy component, my background in rehab counseling, people with disabilities. If you are from an older community, if you are from an African American community or another race, if you are from a religious community, particularly those that have a strong history of feeling like you're persecuted, if you are from, if you're a part of the LGBTQ plus community, all of these groups are working towards acknowledgement. And you can use the word advocacy. Some people take that as like political power. Some people take it as social power. Some people say, I want to advocate because I want to live in a world where people accept me as belonging, not telling me I should go away and I'm not worth anything. Depending on how you conceptualize your work, could go either way. But advocacy and speaking up politically, socially, or finding, building communities of caring and support around you, whether it's neighborhoods or, online groups or whatever that is, it's all part of this. We'll talk a lot more about advocacy in class probably too. When I show you the ACA advocacy model, it's part of something we're going to used to do. And actually you'll get it in another class as well. We'll talk about that a lot more because you'll have to write a paper in the foundations class if you haven't already. I already mentioned pathology versus normal development, so we'll skip over that one. Counseling is for everyone, not just the sick. Again, normal person problems. Here's a nice quote that's, I'm going to get my head out of the way here a little bit. The wellness model focuses on overall functioning in mental and emotional areas, including specific areas like family relationships. Think of all the things we're going to be doing assessments with. Family relationships, friendships, other relationships like work, community, church, etc. Career and job, your relationship to spirituality, if you have one, your leisure activities, your physical health, your living environment, financial status, sexuality, and I'm probably missing some in there somewhere. These are all parts of the ingredients of the wellness model. In other words, all of these things matter and we should probably pay attention to them. And if you're not getting or doing enough in one particular area, you might be missing something, thus leading to some issue. Okay, so hopefully that makes a little bit of sense. Okay, let's talk about the profession specifically. I was pausing because I was trying to think of what I actually needed to say for this slide. When we think of the activities that we perform, the services that we perform to other people, primarily the activities are counseling in nature. Now, the question is, what exactly is that counseling? Because if you're coming here to be a therapist, this is a little nuanced, but it's kind of important. Therapy is a specific job. Counseling is a bigger, wider, broader category that involves different kinds of helping and support for normal people problems. Does that make sense? So primarily the roles that you're going to take on when you're doing within the counseling profession are counseling-like activities, but there may be other things too. Now the question is, how much is that within that Venn diagram of counseling and how much is it outside? So rehabilitation counseling, which we're not going to spend a ton of time talking about because you guys aren't going to be one of those. But school counselors, you might, right? So this is particularly for you, Claire, in this class anyway. School counselors, they do things that look like therapy, but they also do a lot of other things like develop schedules and do check-ins to rooms just to make sure things are going okay, and supporting teachers and talking to families about test results and academic successes and academic problems and that kind of thing, and college potential and that kind of stuff. That's a lot different than what we conceptualize as like normal person problems, right? Or therapeutic kind of work. And yet, isn't school and the educational process of growing up and learning things, isn't that part of what normal people do? And doesn't it kind of go awry sometimes when there's bullies, or you don't know that you can actually go to college or how to fund it or that kind of stuff? So it fits within the Venn diagram of counseling, but there's also these outside activities. There has been plenty of debate over the years, and by over the years, I mean school counselors existed before mental health counselors, and rehab counselors existed before school counselors. So over the years, the mental health therapeutic community has garnered a lot more power and recognition and acknowledgement. And school counselors say, hey, we do all that kind of stuff too, but we do this other stuff. The question is, are we like the therapist, or are we like something that's completely different? Said differently, are we part of the counseling profession, or are we our own unique, different profession? Okay. That's the complication of identity is, am I one of you or one of them? Right. So think of a person who's, some of you might have these like crossover identities, so to speak, like the second generation immigrant who says, well, my whole family was Vietnamese, but I'm an American citizen and all my friends are white American, Euro ethnic people. So I feel like I'm torn between these two identities, and it creates these conflicts that are incongruent sometimes with each other. Same here in the professions, same kind of dynamic going on. Psychiatrists diagnose and provide medical treatment. Psychologists provide assessment and research, primarily because they trade to the doctoral level, mostly, with a little asterisk. I'll tell you about that later. Social workers typically provide links to community services or community resources, things like child protective services and foster care and SNAP benefits and housing and that kind of stuff. If you talk to social workers, it's really interesting because there are lots of therapists who come from the social work profession. There are lots of therapists who come from the counseling profession. There are lots of psychologists or clinical counselors. Wait, I'm getting this wrong. Counseling psychologists, that's what I'm talking about, who come from the psychology profession. And then there are all these other people who are part of these various professions who do things that are completely different. It's not therapy, right? So this is where we are in all of our professions, is trying to sort out, so who are the therapists? Are they social workers? Are they counselors? Are they psychologists? What is it? Or does one have a monopoly on this part of the thing, that the service that people are looking for? So a lot of you are going to be a little bit confused about like, well, I don't want to do therapy, or at least if I do therapeutic kind of work, I don't want to sit for 6 hours a day on my butt. I want to go out and do something. I want to create programs, and I want to change the world, not just one person at a time. And that's okay. It's just really confusing based on the kind of things other than therapy people do, because it takes so much priority and precedence in the way we talk about it. Okay, so we'll hopefully that leads to some of your questions, and we'll talk more about it as we go on. But I don't want to dig too deep into that because it can get kind of just messy and complicated. Lots of overlap, though, of course, which is where politics can happen. Case management. Now, case management means a lot of different things to different people. In the social work world, often, and the rehab counseling world, oftentimes it means I call with these people, I check in with them, I make sure they have what they need. I make sure, like in my rehab world, sometimes depending on the role, it was like, last time we checked in, you were doing this thing, and I'm just for, like, let's say you were trying to find a job and you needed to go get some applications, or you were rewriting your resume, just checking in where you're at. We don't need to spend a whole hour talking about your feelings. I just need to like check in with you. Or maybe you need more medicine, or maybe if you're maybe a social worker helping somebody with housing, is like, did you lost your housing, so we're now finding another one or something. And there's a lot more of that, like check in and follow up with people. The case management for a therapist, for those of you that are doing that kind of work, is like, how do I plan my schedule accordingly so I can also do my documentation? And if I own my own private practice, I can also pay attention to things like, I got to go out and network and market a little bit. It's really important that I continue maintaining my referral base, or maybe diversifying my offerings by saying I'm going to do some groups and then some individual therapy, and I'm going to take some pro bono clients and also see some from the court system. And these kinds of business planning things require managing your caseload. So we can talk more about that if you want to, but I'll leave that there for now. The book says counseling is educational in nature. The question is, what the heck does that even mean, and how much? So I'm going to leave those question marks with you now just for the sake of time. Some people as therapists say our job is to listen, so let the person talk, right? And other people say, no, I need to inform people about their condition, or others say, I need to tell you the way that you should be living your life, and that you're making bad decisions, and here's the road to good health if you make these decisions. Some of those are like, yeah, that seems good and that checks out, and others are like, that's not how that works, dude. You don't tell people how to live and what they're doing wrong with their lives. So there's a conversation to be had there about what educational means, which is why I'm like, how much is really involved in this, and who gets to determine what is right for one person and not for the other, or what good information you have and whatever. So we can talk about that if you want to. Just to reiterate a little bit to keep us focused, part of our identity as we're thinking about what is our identity is how we're trained. So the kind of information that you get here in this process, and then the license you get when you come out of it, or the certification, or the further trainings that you're going to get, those determine the kind of professional you are. So you guys are all here and part of a counseling program, and you're going to get a license acknowledged by the state of Wisconsin in counseling. Okay. Social work has their own license. Marriage and family has their own license. One of the things that's happening right now, though, is that, and this is a really contemporary sort of new thing that I get to, for better or worse, be a part of conversation and do a little bit of advocacy work around this, is that traditionally psychologists have said, you can't do this work because it's so complicated that you can't do it with a master's degree. Remember, they were sort of born out of psychiatry. The medical field doesn't have a medical doctor that has a master's degree, right? You have to go through 6 years of medical school, or 5, whatever it is, to become a doctor. And so psychiatrists, medical doctors, psychologists have always said 6 years minimum, or at least this amount of curricular minimum. Side note, that's actually changing a little bit with oh my gosh, I'm blanking on the term. I have a friend in Milwaukee who's one of these, I'm thinking nurse practitioner, but that's not it. But he's screaming at their computer right now. Somebody will help me out, or I'll think of it in a few minutes. But there's a person who goes to school for essentially a graduate degree and does what the doctors do, because now the doctors have more responsibility to oversee patient visits and different things too. PA, physician's assistant. That's what I was thinking of. Thank you for those who were psychically emitting your energies through the computer and back in time to me, whatever that means. Anyway, so physician's assistants have less education, but they're taking on the roles of what doctors used to do, especially when there are shortages of doctors. Similarly, in our field, this is getting back to our point here, is that psychology used to only allow the licensing of doctoral level people. Now they're starting to accredit master's level programs, because all states have a licensing board now. They didn't always, but all states now have a licensing board that licenses people to do therapeutic work at the master's level. So psychology students are saying, well, I want to get a master's degree, don't want to go on to a doctorate, but I can't get a psychologist license because our state doesn't allow it. But I could do the same thing as those counselors, so why can't I just get one of their licenses? And so there's this challenging, controversial dispute over, should psychologists get licensed as counselors just so they can do therapeutic work, or should they have their own license to do their own work? Because they never let us play in the sandbox back in the 1950s, when they said, either fall in line with us and get trained like a psychologist, or go do your other thing, and you're on your own. So anyway, this is the drama. I can explain more about it or talk more about it later if you want to get into the drama. There is a place for these conversations, and then there's also a place to say, are we really arguing about the right things? Are we really putting our energy where we really need to be? So open questions for all of us. I guess I will say one more thing about that. When you hear people, and I do it tongue in cheek, I did it last week, I'm probably going to do it again. When I hear people say like, oh, because social workers do that and they're better than us, and those kind of things, it's so stupid. It's so stupid. But when people feel like their work is being threatened or they're being pushed out of a job, it starts to become really important. And I fully acknowledge that I'm in a place of privilege where I don't have to deal with these really impactful situations where being pushed out of a job, or not able to work at a certain place, or help the certain kind of clients that I want to, or something like that. So I don't mean to belittle it, and I also mean to refocus on prioritizing what matters the most. So enough said for now. Part of training and credentials is making sure that people have enough knowledge and enough understanding. And dare I use the word, people have enough maturity to handle the responsibilities of the job. Okay. So part of that is just the degree that you get. State licensing, as we mentioned in previous lectures last week, we said that their main priority is to keep people safe, right? We have to have a process to manage. If you have the license, we'll let you do this work. But if you do start doing goofy stuff, we're going to take it away and you can't do the work anymore. If you don't have a license, you can't regulate people. You can't keep the bad seeds out. There's no formal legal mechanism to like get rid of them. That leaves it all up to individual practitioners to sue each other, right? So if you have a licensing board, then the state can say, you practitioners are clogging up the courts. You don't need to go about suing each other. You don't have the money to do it anyway. Let us regulate that through this board process. And that creates a layer of protection for the public, essentially. That's why every state has one. National certification in specialties. Some rehab counselors don't typically get licensed. In some states they do. So we have that layer of protection is by a certifying body that oversees all rehabilitation counselors. It's called the Commission on Rehabilitation Counselor Certification, CRCC. They write the code of ethics. They revise the code of ethics. They handle ethical complaints against other counselors. They do all that kind of stuff as one organization, not as separate states. States don't seem to think that rehab counseling is dangerous enough or powerful enough to require licensure in that state. So, but there's a lot of politics involved in that, and it's a conversation for a later time. Another thing that states rely on to make sure that people have, or two things, I'll lump these together, to make sure that people have the right kind of training and they're of the right quality, is you have to pass a knowledge test, which is what you guys will, the NCE, given by the NBCC, that's the national exam. And then the programs, our training program has to be accredited. In other words, the state licensing board says, have you passed your test? Because we know their test is good. And if you've passed it, we trust them, because every other state does too. Have you been to a school that's accredited? Because if you do, there's this third party accrediting body. Ours is called CACREP. Oops, my hands are getting cut off. Ours is called CACREP. Sit on the board of CACREP, so I'm pretty intimately aware of how these standards work and how this process works. If they've said the training program was good, then we'll trust them because we know them. So, and there's all these different degrees that you can have too. So hopefully what you're seeing is that there's these different layers of protection to make sure people are doing the best work they can, to make sure the training is solid, to make sure that the public is going to be safe, and all these different layers of political advocacy and public advocacy have helped create a system that is both complicated and messy and sometimes ridiculous and really important. Okay, so that's all I'll say about that for now. Just in case you're curious what these mean, Master of Science, Master of Arts, Master of Education, Master of Divinity, etc. But all these people have the potential to engage in counseling-like work or therapeutic-like work, depending on your role. Okay, a lot of licensing questions in there of who's trained adequately and all that kind of stuff. That's where all the fights happen. But nevertheless, that's what they are. I'm not even going to read that red part because you guys I'll get out of the way so you can pause it if you want to read it yourself, but I've already kind of mentioned all that stuff. One thing I will mention, maybe it's not interesting, but there's a new accreditor in town. Feels like the Wild West when I'm talking like this. But I sit on the CACREP board and we have conversations about, because psychology wants to license people at the master's level, and because states require a third-party person to vet those training programs, that's what accreditors do. They said, well, we want to vet these master's level psychology programs, but CACREP, they won't play nice with us. The counselors won't play nice, so we have to make up our own accreditation. And there are some counseling programs who are like, CACREP, you're not really doing it for us. We don't like you, so we're going to go over to this other one. It's called MPCAC, or a Master's in Psychology and Counseling, or something like that. So there's a little bit of drama there, but you guys don't have to care about that now. We can talk about it later. I've already mentioned some of these things, so this will now hopefully go a little quicker. The foundations of a profession. How do you know if you're doing a job or a practice or a profession? Counseling is a profession. You don't really have to care about that much, but these layers are licensing, self-regulation group, which we've already talked about. There's a code of ethics that's really important because people have to have a guide and especially the licensing boards, if people are doing weird stuff, what is weird to us? Like, how does every state collectively have a common understanding of what's acceptable and what isn't? It's not just for you to help guide you through good behavior. It's for all of these other people to say, this guy's trying this new innovative weird thing called hypnosis or psychedelic assisted therapy or ketamine assisted therapy. Is that really okay? Like, is that a good thing? So the profession builds the code of ethics. The various states use it to help regulate. It's really important that it's kind of built collectively, used collectively. Professional organizations provide continuing education to keep people current after school. They provide advocacy power. One of the things that I was, I guess, privileged to help out with was the Counseling Compact. We're not going to talk about it right now. We'll talk about it later probably. But the Counseling Compact, the strange word, essentially means if every state is licensing people and all those licensing requirements are different, then it's really hard for people to move states or meet requirements if they're traveling around and moving around. And it also means that you can only practice it within your own state. So you won't be able to practice outside of your state unless you get licensed in those places. But the compact essentially is an agreement to say, let's make that process easier. Let's work together a little better. When I was in Montana, I testified in front of the Montana House in support of that compact because it just made sense. It was right after COVID and the environment was right for making some rule adjustments to that stuff in various states. So we can explain that later, and you'll hear a lot more about it by the time you graduate and get to that licensing part. Developing a clearly defined scope of practice, what we do and what we do not do, what makes us unique. It's a good conversation piece to have in class. I'm not going to say anything more about it because I've already said probably enough for now anyway, but there's a lot about that question that still confuses me. How are we different and how are we the same, and should it be that way? That's the big question in my mind. And then research. Research is also a foundation of a profession because it forms and establishes what works and what doesn't, and what's within and outside of the profession. It's how people discuss or have discourse over an entire profession. It's really hard to have discourse when your voice only travels within the room that you exist. You know what I mean? So unless you're writing books or contributing to the scholarship of the field or attending all the conferences all the time and spending all that time and energy and money, that's a really hard thing to do. So research is one of those ways to help gain a body of knowledge about your specialty topic. So enough said about that for now. How are we doing on time? 45 minutes. We're doing all right. 2 slides left. If the astute of you will notice that I put a slide counter on there so that you kind of know how far you are away, and also for me too, so I can keep on track. Okay, so we've already got through a little bit of a history, so I don't need to repeat too much. But I'll give you a history lesson in a different class. I think I love the history lecture. It's so fun for me, but I'm kind of a nerd like that, and I like the history. You guys may not care about that part so much. It was originally people coming back from not so much Civil War, but that kind of primed the impetus for World War I. People came back with injuries, and that was through the Industrial Revolution. So people were moving from farms to cities, changing jobs, changing lives, and it was complicating modern life at the time. And so there were people around that were becoming experts in helping people make those life adjustments from farm to city, from war to civilian life, to from a full able-bodied person to somebody who has either an amputation, a visual disability, a hearing disability from all the cannons in World War I, to what they called shell shock, which we now think of as PTSD. So people were experts in making that transition. Those were the rehab counselors. Those were the first ones. The next ones were school counselors, because when people moved out of their little schoolhouses in the 1800s, Little House on the Prairie style, and moved to like public institutions that were created and regulated by the government, then school counselors were helping families get their children into that process, and then the kids getting up and out into work. That was the original school counselor. And the mental health counselor, we've kind of already talked about them, but sort of like the support for normal people in normal contemporary life. some of these other things don't really matter quite as much. I can show you some charts and graphs and that kind of stuff if you want to. They're kind of fun to look at. Particularly, we might see one about the year in which the year in which states actually had a counseling license. For you, it may seem like, oh, counseling has been around for everybody. I learned about Freud, so therefore. But there are some states that weren't licensed until like the 1980s. I think, like, I don't forget, it was New York or California. It wasn't until like the 90s when they actually had a counseling license for you to do the work that you're doing right now, which wasn't that long ago. I was born in 82, so seems strange to me, but it was an eye-opening experience. But it used to be that people got only had to take 30 credits, and then for a long time it was 48 credits, and now it's 60 credits. In other words, I think the counseling professions are acknowledging that, hey, there's a lot of stuff that you need to know to be really good at this, and also to be safe and effective. So since the that's not the right word, not impetus, the inception, that's where I knew it was an I word, since the inception of the profession, people have been saying, well, maybe not saying, but like people are acknowledging that even though the psychologist wouldn't let us play and required this doctorate degree, we said you just need this base level to do this normal stuff. But as the therapeutic work gets more complicated, there's, I think, some acknowledgement that like there are difficult parts about life, and we need to have more ethical training, like you guys are getting now, more training in ethics to fully understand the complicated legal nature of the responsibilities that we have, and also to be able to treat certain things. You need more training. So it's kind of expanding outward because some understanding and acknowledgement. Part of my challenge in this class, and part of your challenge as a student, is really understanding what that responsibility is and thinking what might those complications be, and then saying, how do I build the capacity to handle more of that responsibility in the future? Already mentioned licensing in every state. Laws are passed to provide privileged communication to protect clients and counselors. So that's another thing that's really important. I think I'm going to skip over that kind of for now, but we'll come back to this for sure and understand this more as we get into this. If you remember on the syllabus, we had like the legal units in like the second quarter of the class or something. But essentially what we're talking about is as things got complicated from just helping a person out, because I'm a kind-hearted person, to there are some unique legal situations that I need to protect clients and protect myself from. One of them is if people tell me highly sensitive things, and the courts can come in and say, well, you have to tell us about those sensitive things. It really contradicts the therapeutic process. If people know that this information could get out, they're not going to talk to us, in which case it sort of makes counseling useless. There's no trust there, right? So one of the important parts of counseling is legal protection, as well as just the gentleman's handshake that I'm not going to say anything to anybody, or the gentle lady's handshake, we'll say too. So privileged communication will come back up, but it essentially means I can keep things private even from the courts. We have some limitations with that, of course. Other professions like lawyers, they do not. You go kill somebody and then go hire a lawyer, the courts can never ask the attorney to divulge that in any case. We have a really crucial and important exception that everything that we say is private. It's privileged communication, which means it's private just to me and my client, except risk or harm to self or others, vulnerable adults, to children, and kind of those unique situations too. So we'll talk more about that when we get there. And then I'm just going to skip the last one for time's sake. It's probably self-explanatory. Body of knowledge increase. There you go. So why advocate? We've already talked about how there's lots of drama, there's lots of controversy, there's some parts of it that are really dumb, there's some parts of it that are really important. Why advocate? You guys have the opportunity to go out and think about how you want to advocate, in what settings and in what ways. What are your skills? What are your interests? How big of an impact do you want to have on the world and all that kind of stuff? That is a conversation probably worth having in class and worth thinking about for you individually. We have certain parts of this program, like you have to write a paper in the foundations class, and I love these taglines because they mean something, but not always to you guys. We're like, we want to develop leaders and advocates in the world and all that kind of stuff. once you get out into the practice for a while, you'll start to get more and more of a sense of what that means. Once you start hearing about other practitioners who are your clients are telling you like they don't do a good job, or you send clients to get a certain service and you're like, that person is unethical, I'm never going to refer to them. You're going to start to get a better picture of why advocating for a safe, healthy community of therapists is a really good thing. Or you're a veteran and you want the VA to hire counselors instead of social workers, which is a pretty recent development for the most part in the last 5 to 10 years. If that's your thing, then you may have reasons to advocate for that. Starting to lose my train of thought a little bit because I've been talking too long. As we think about how you want to advocate, I know what it was. You get to think about how you want to advocate. Right now, probably most of you, if you're in your first or second year of the program, you're probably thinking, I want to learn how to be with clients. I'm here to get a better job, and so I'm thinking a little bit of my career trajectory, but usually that starts to be more important in like practicum internship time when you're thinking about getting out into the world. Right now, probably your primary focus is on clients. That is okay. You're understanding the profession. Lectures like this teach us about our identity and our roles within the profession and some of the laws and legal stuff. But mostly it's primarily about clients. What I'm telling you now, even if you're like, well, yeah, I want to change the world, but I'm focused on clients. This is the kind of stuff that you may want to just put in your back pocket and save it for later. Yes, it's important now. Likely it's going to be even more important to more of you later. So just so you know, I'm not expecting you to be like, I'm an expert in advocacy. That doesn't happen until opportunities arise, really, So let's talk about this really quick. Here's more of the drama. Other professions lobby, in other words, influence lawmakers to not allow counselors to, and this has historically been psychology and social work. Also, let me say that some counselors do this too. Counselors, psychologists, social workers, marriage and family therapists, there's people part of all of these things that like to fight and that like to advocate. And for some of them for good reason, and others just because they love their nervous system to be constantly buzzing, like on high alert of like, we need to make an enemy out of those guys. I am not that guy. So even though I say things like this of like, they don't want us to play with them, it's not really because I care about that or think that's the way to talk about it. It's because that's the way these things can feel sometimes. And you should be aware that these things are happening, not driven by the entire profession per se, but by the select individuals who have taken on as their role to get in these fights. So I think that we're probably misguided a little bit, although I sit on the accreditation board and I get to be a part of these decisions that get made that sometimes feel adversarial to other people. And I can give you examples. I'm just not going to do it right now, but with my best intentions of us working together, sometimes things don't get experienced that way by others. But so here's an example. Psychologist, if a counselor graduates with a PhD in counseling, they cannot work in a psychology program. Similarly, right now, one of the big issues in accreditation is that there are plenty of psychologists who weren't trained as counselors, but they were trained as psychologists, but are working in counseling programs. And there's an effort or interest to say, is that how that's supposed to work? Because they sure don't let us teach in their programs, and we don't want them teaching in ours. And probably you guys, most of you who are sitting there, and the general public are like, who freaking cares? If you're helping people live better lives, then who cares? It may not be an issue for most people who are just like, you guys figure out your problems. I just want to see a therapist. I want to feel better and live better because I want my dog to not be dead anymore. I don't want to get a divorce, or I want my kids to get along with me, or whatever, People don't care about these things. And yet there are these parts that matter, right? So who can conduct psychological assessments? There are limitations to what you can do because I don't know who did it, but in many states, because psychologists have had more power because they've been around longer, they've limited. Think about this in the context of the history too of counseling. They've said these counselors aren't trained to do these really complicated things. Some of that's true. And so there's been regulation as to what we can do, not usually by ourselves, but by other people who say we shouldn't be doing these things. Now, sometimes there is responsible stewardship for us as counselors and social workers and marriage and family therapists to say, we never really got trained, and that's not really our role. It's not within our scope of practice to do these really complicated tests like the MMPI or the Minnesota Multifaceted Personality Inventory or some of the intelligence assessments. We don't spend a ton of time, like semesters long, understanding intelligence theory and how to diagnose learning disabilities and autism and that kind of stuff. So we really have no business playing with these tools that are more complicated than we're trained for. That's fine. But for whatever reason, some people are advocating for, no, we should be trained more in these and we should be able to conduct them. And whose business is it but ours to say what we can and can't do? So part of the conversation. There are still states like New York that don't allow counselors to diagnose and make diagnoses. So that's the thing. I'll just leave it at that for now since we're not New York. I think I've mentioned a lot of this other stuff, so I'm just going to brush over this briefly because we're at 55 minutes here. Various specialties versus united profession. Remember when I was saying about rehab counseling and school counseling who were like, we're not really part of you, and school counseling left the ACA, so they don't have a division of the ACA anymore. And rehab counseling is going through this right now. I'm not going to talk to you about it right now, but can if you want to hear about it. Are we or aren't we part of the counseling profession as a whole, or are we something else? So a lot of people think, let's come together and just unify so we have advocacy and political power, or we separate and we go about our own ways, do our own things, and we don't have to fight anymore, whatever. There's varying state licensures. I've already talked about the compact, and we'll probably talk about it more later. Inaccurate job classifications. Some of you have, you might even be working on the title of social worker. Like you get trained as a counselor and then go do social work kind of activities. Because employers, they sometimes don't care what your profession is. They say, can you do the job that I need you to do? And you might say, sure, I can. You know what I mean? It does create some confusion, but is it a bad thing? Who knows? But it's confusing for employers, for the public, for us, for everybody. And so something we're working on, I guess. And advocacy in that sense is just helping figure out some clarity. Doesn't mean you're fighting all the time. It just means like we have to figure out how to get clear with each other. And then third-party reimbursement. People have been accepting insurance for counseling and therapeutic work for a while, and not from Medicare. So that's a new development. It's very new. It's from, sort of a Biden era. I don't know how responsible he was for it, but it's been in the works for a long time. I know that. So it's not really to bring up a political issue and to say that the Democrats are more, maybe that's true. Maybe Democrats are more likely to provide social supports, but still, the point is that took a lot of work on behalf of counselors to say, well, if you're going to give out this money for social supports, give it to us because we can help. Look at the good work we're doing. That's one of the ways we do this. So that's it. That's the end. At some point, I decided I was going to leave you guys with a quote. So I'll leave you with this one by Potter Stewart. I have no idea who that guy is, but I found it and it's awesome. It says, ethics is knowing the difference between what you have the right to do and what is right to do. I think in context of our last conversation that this is probably somewhat salient or poignant for some of you. What is right to do and what we have the right to do. Interesting. So thank you, and I will see you in class next week.